Good afternoon, good morning to wherever you're connecting in today, and welcome to the EphMRA webinar. We've decided today that we're going to do a webinar on all the member benefits open to everyone who's a member of EphMRA. And we welcome you to hear this and to get feedback on it, because we've got a lot to say. Quite often when people have really busy lives and it's difficult to open all the emails we're sending out, we know that some of the benefits of being a member of EphMRA don't always come through on our communications. So we thought we'd bring it all together today, and we're going to then record this, put it on our website, so any of your colleagues or companies who aren't members of EphMRA, we can then ask them to go and have a look at our overview of all the member benefits. So we're going to give you a walk through what is EphMRA about and some of the key things that we want you to take advantage of. So the aim today is to give you an update on what your membership of EphMRA includes and how you can make sure that you're taking advantage of everything that we have to offer. If you'd like to ask a question at any time during the webinar, there's a tab where you can type in a question, send it in, and we'll have a look at it and hopefully answer it at the end. We'll do the introductions in a minute, and I'd like you to tell you that we're also recording it, so we won't reveal your name if we're going to ask any questions anyway. So what are we going to cover today? Well, we're going to have a look at a little bit of introduction. Then we're going to walk through some of the key elements to the EphMRA work. And that means working through some of the committees, not just about what they're doing, but much more about what it means for you as a member. Because that's what we want to focus on. We want to focus on what we're doing behind the scenes as well, which is supporting you in your own work. It's a huge range of things that go on in the background. Ethics obviously is very visible, but quite a lot of committee and working group outputs, they often go on in the background with our whole host of volunteers. But first of all, let's do some introductions. So, hello, I'm Bernadette Rogers. I'm General Manager of EphMRA. I have been working with EphMRA now for many years, and basically I take all the board initiatives, what the board wants to do, where they want to focus, and I work with our team and get that translated into the outputs, the deliverables, the activities that the members want to see. So working with a huge team of volunteers from the membership, our contractors and freelancers, and also obviously with Sally Birchall, who is our relationship manager. So Sally, would you like to just introduce yourself right now?
Thanks, Bernadette. Hello, everyone. I'm Sally Birchall. The relationship manager is a great initiative from the board, who are really keen to facilitate two-way communication between the association and EphMRA members. So my role as a relationship manager is to help members make the most of their EphMRA membership, and also at the same time help the association adapt to meet members' needs now and in the future. And a little bit about myself. I have worked in international pharma market research for more years than I care to remember, both in agency and pharmaceutical company environments. So hopefully that gives me a bit of an understanding about your day-to-day business lives and how EphMRA can help with some of those pain points and support you with your day jobs. Thank you very much.
Thanks, Sally. So Sally and I work close together. Obviously, we're discussing about where we are with all our individual member companies. We have a tracking sort of Excel spreadsheet whereby we also track things, and we're also talking about what our interactions are with different member companies. And we also have a strategy about attracting new members to the association, both from the industry side and also from the agency side. So we're quite busy in that, and the most important thing is we want to keep in touch with you, the members, and our members will testify to that because we have calls, we send out emails, we're doing this webinar, and also we post quite a lot on LinkedIn, etc. So that is what Sally and I are doing and talking together. And we thought when we had a meeting that we would like to do this webinar. Much more importantly, to give an overview, but also to record it and make it available to other members. So just let's recap, first of all, when we start now, about what is EphMRA aiming to do. This is our mission statement, and it's been our mission statement now for a few years. It's been slightly tweaked, but it has stood the test of time because we're here and all our activities are aimed at creating excellence to help you, to empower you, to inspire you, to support you, really in your daily work, because that's why we want to focus all our resources. We want to make sure that what we're doing meets your needs, it fulfills and supports you, and also it's tailored. Sometimes we do things which are more tailored to different types of member groups, but all the time we're thinking about how it can work across the EphMRA membership. And that's where Sally and I talk quite a lot about how we're working together about different strategies for different types of members, member companies, big companies, mid-size, smaller, boutique agencies as well. And also we're talking about tailoring what we're doing to make sure we have an overview, but also we can then tailor it down. And that's also part of our personal service to the membership. So I mentioned that we're fairly closely in contact with a range of companies across our membership. And we asked them, well, why have you joined? Why do you join EphMRA? And only this morning I had an orientation call with a new member company and said, well, what was it about joining that you wanted to, why did you want to join? So we know from feedback it's fairly consistent, and there's particular reasons why people want to join, why companies want to join. First of all, they do want to keep up to date because we're addressing cutting-edge topics, we're right at the forefront, and we're making sure that we not only keep informed and up to date, but we're also making sure that we translate that to you. For our industry members as well, product classification. So I'll tell you a little bit more about that later, but obviously we have the classification committee, and it is EphMRA who keeps the order in the classification landscape. Our committee looks at product classification, where the products fit in the market, and we make sure that it is reflecting members and market needs, and I'll tell you a little bit more later. Well, ethics and compliance can't get away from that at the moment, can you? There's always something to talk about, and we have to make sure that we too keep up to date on that and keep the members well informed and supported. And again, there's more about that later. So these are the key things. They want to join in our conversation, members do, about hot topics. And you'll see a bit later that the conference and our one-day events are also covering key issues and topics that our members want to address and they want to hear about because it affects their daily work. Obviously, networking. There's face-to-face and e-networking as well. And also making sure that you're part of the community. The company I was talking to this morning felt it was time to join the group, to be part of the dialogue. Their clients had been asking them, are you a member of EphMRA? And so they felt, yes, it's time for them now. It was a good time to join the group and to become part of this community of healthcare market research and business intelligence. So those are some of the key things that we've heard from our members. And here's just a few quotes. So why do members join, we say? So obviously, putting the membership, we issue a logo for membership, certificates, and also this code of conduct certification, which we'll come on to later. And obviously clients, their own clients, are reassured by that series of qualifications, certifications, quality stamp marks. That's what they want to be able to put in their proposals. Another industry side member said, well, we're a mid-sized pharma. We're not at the top, but it's important for them to stay connected and be part of the community. And they can also learn from other pharma companies by talking, by networking, and by sharing ideas. And also, like, there's a connection. They're one of our agency members feeling well connected, but obviously for them, because they're involved in our world, they feel that EphMRA is the most relevant and up-to-date organisation for them. So those are just some of the typical sorts of quotes that we get back from, well, why did you join? But obviously there is just so much more to EphMRA. We're not just looking at an event or one specific thing, but we have now become the authoritative voice in healthcare market research. And we know that because we are well connected across the association world now. We are recognized across worldwide, across other associations through our GARBN network, that's the Global Research Business Network, as the leading and the authoritative voice in healthcare market research. They come to us now to ask also for advice and input. They recognise that we have the leading specific healthcare market research training, and also we want to emphasise that we are addressing the topics that matter to you at the forefront, and we'll mention those as well a little bit later for the conference: AI, technology, machine learning, agile research, digital engagement, the bigger picture, and also fair market value and incentives. And also, obviously, we are well connected, as I mentioned. So we've got good connections into the China Market Research Association, and we hope to welcome some of those delegates to our conference this year. The Japan Pharma Market Research Association, ADM in Germany, EphMRA, a whole range of associations across Europe and the world are reaching out to EphMRA to collaborate and to join with us. So this is just an overview. We have various thank you for joining and welcome to the association, which give PDFs and leaflets that we send out, which gives an overview of the and it's a handy reminder of what some of the key member benefits are and what else you can do to maximise, to activate your membership. I won't dwell on that too much because we're going to come back to it, but we do have quite a lot of communication points and leaflets available that we do send out, which can remind our membership about where they can go to become connected. But of course, you know, most of our members love to be in contact, and they're more than happy to drop Sally or I an email. Now, the executive board. So I'll just talk a little bit about that and some of their work streams. So last year, actually, in fact, in 2018, some work streams across the board members. So there are 12 to 14 members on the board, and they were divided up into some work streams to look at outputs from the 2018 members survey. And we divided up into 3 teams. They were looking at culture and the whole the whole emphasis of what that can have on all companies and associations. Conference, events, obviously the conference is a key element for the association, and networking and promotion. So some of the things which we managed to look at and change quickly in terms of on the culture side was about transparency and inclusion. Because we had some feedback that it would be better if we used just the word members. We don't subdivide in terms of other terms, so we have agency members, industry members, but generally everybody are just called in terms of members. Before, the AGM was only open to industry members, but now we've opened that up and it's open to all members to come along. And we have much more transparent now, based on feedback, about financial reporting and the way we present our financial reporting. So we were able to make those changes from members' feedback, and the feedback on that was really, really positive. And it's made a big difference in terms of our communication and just understanding what it is that members want to hear from us. We've also focused on adapting the conference, and if you haven't had the opportunity as yet to look at the Antwerp conference program that has been launched, we have more papers now and more paper streams. So one step that we have taken based on feedback is that we have taken out the conference workshops that used to be on the Tuesday afternoon, and we've moved those to an online format now. So the conference, if you're planning to come on, starts on Tuesday afternoon. The opening of the conference with keynote speakers, Tuesday afternoon if you're thinking of coming and planning travel. It's not Wednesday morning anymore. We've packed in more papers, more formats from discussion points to TEDx-type talks, and also streams. We also have this year, and you'll see a bit more later, is an agile research stream for those working in field and ops. And also about networking, our networking stream. The board members there have been looking at the possibility of developing an e-community through the website, and also a directory for suppliers and for those working in the healthcare market research field. So we'll focus a little bit more, before I'm going to hand over to Sally, about how our committees are working for you, and also about our ethics service. Quite a busy slide, I appreciate, because we've got a lot to say about the work that goes on across the association. From classification right the way over to learning and development. We could talk 5 minutes on each of these, the work of and the outputs of the committees. But they are key elements focusing on different areas of the association's work. I mentioned about classification, maintaining a very stable landscape and making sure it meets the industry side's needs. data and systems, working with suppliers. So if you're in the data platform area, that's the committee, and they work with suppliers. It's an industry committee working with suppliers who have platforms for data. New form codes, the dosage forms, which have to be aligned and maintained. Ethics, obviously I'll come on to that as well. And learning and development. Key part of our whole offering is about professional development, learning. We have webinars, and we have a program for young researchers, which you'll find out more a little bit later when Sally tells us more. And it carries on. We have more specialist groups focusing in areas. The program committee, a very active, a very focused committee looking at delivering the very best high quality content at the conference. And our evaluations from the conference have been increasing over the years because we know now that the content is absolutely what members want to hear. And we're looking all the time for the most engaging speakers and the most engaging topics. Forecasting, a very active forum for those working on the industry and agency side, coming together to talk about key topics relevant to them: forecasting, market access, forecasting in China, how to present forecasting results. Very active group meeting virtually about every 6 weeks. Fieldwork forum. From our talks across some companies, we know that fair market value is a key element, talking about incentive levels, caps, how to recruit respondents for the right level of incentive. And we're going to be looking at establishing working parties more to establish not exactly how much you can pay, but looking at some of the challenges across some of the respondent groups and where we can support our membership in terms of looking at not exact incentive levels, but maybe some areas where we need to look at ranges and give some guidance. Devices diagnostics, if you're working in that area, a specifically focused group. And also something that we're thinking of developing and looking at more now is market access. They're doing very similar work in some cases to us, maybe focusing on stakeholders, payers, KOLs, but still a very important part of what we're doing. And ethics, well, it's a key element I think I must be working on. So some aspect or something to do with ethics almost every day. We deliver to our members an annual code of conduct update. We have, at the moment, revising the adverse event guidelines. We have newsletters going out. And also, as you can see on the right, we have key point booklets there. They're available on the website to help support you if you have some quick questions that need to be answered. You can go to the website, log in, and pick up one of those key point booklets, which might help to answer some of the questions. That's a very quick overview of our service, but how do we deliver it? Well, again, it's our connectivity, our ability to connect with other associations to deliver that service. So our key connections, as you can see, are with EphMRA and EphMRA. EphMRA is the European Federation and Association of Market Research Organizations. They interact and do the lobbying for us. They then feed that down to us, and we then translate what it means for healthcare. GRBN, the Global Research Business Network, is also a key connection to other associations in different parts of the world, like South America, Asia, Australia, etc. And that's how we deliver our service, by keeping well connected with the groups that matter. Just some feedback about our inquiry service. You know, you can send us in an inquiry. We ask our ethics consultants to have a look at it, and we give a reply in writing, because obviously some of the inquiries can be quite challenging and quite complex, and we need time to think about them, and then we give feedback. We know that they are really welcomed by members because they like to then take our advice and say, well, EphMRA has advised that. It gives authority, and it also gives good insight into what we're thinking as well, because obviously through EphMRA and EphMRA, we're at the touch points of really cutting-edge thinking and the latest thinking on some of the key issues. And this is some of the ideas, some of the feedback that we've had about thanking us for some of the inquiries and how it has helped our members to answer some of their own internal inquiries and queries with members, with their own clients. So That is a whistle-stop tour through some of our key elements. And now Sally is going to focus a little bit more on about a key benefit, which is our training deliveries. Sally.
Lovely. Thank you, Bernadette. So the training that you're probably familiar with from EphMRA falls into two broad parts. So there's the ethics training, which I think most members are very familiar with, and then more on the technical side, focused on the research and the business skills that we're all trying to gain and perfect. A couple of quotes there just as feedback from members that we have spoken to about EphMRA and the training that we do provide. But let me take you through the ethics training specifically first. So EphMRA provides two training courses, online training courses. One is the Code of Conduct training, and the other is the Adverse Event Reporting training. So very specific online training courses that any member can undertake. Following these, you then can complete your competency test, which leads to certification of competency, which the feedback we receive is that most members are aiming for that certification as a guarantee of their business standards. We heard from members who are also members of the BHBIA in the UK that there was quite a lot of overlap there, so we've managed to streamline the process. If you're already a BHBIA member and have gone through their certification, there's a supplementary test that you can conduct, which complete, which then just rounds off the other areas that enable you to meet EphMRA's full requirements, which obviously as a multi-country, as an organisation that looks across the globe, is broader in nature from the local industry organisation. So you can either do the complete test or the supplementary test, depending on what suits your particular circumstances. And that's exactly the same setup for the Adverse Event Reporting training course as well. There's a supplementary test for those who've already got some certification at a local level, or the complete test for all. So on the ethics side, as I say, I think most members will be very familiar with that. But the other arm of training from EphMRA is from the Learning and Development Committee, as Bernadette mentioned. And this looks more at the technical or business training side of things. And the LDC currently has two training streams. So there's the 2019-2020 training program, and this consists of webinars on a range of topics. I've listed them out there, from market understanding to monitoring post-launch performance. And we've heard feedback that many of our members incorporate the EphMRA webinars into their in-house training programs. Obviously, a lot of the larger companies will have their own programs, but they like to get everyone involved. Everyone can watch the webinar together as a group, hold some discussion afterwards, build on it in terms of implementation into your own companies. And they found that a very valuable way to go forward. The second training stream is aimed specifically at young researchers. So the Young Researchers program consists of a combination of online courses and also webinars. So there are three online courses. Again, I've listed them there. The International Pharma Market Research Introduction, Research through the Product Life Cycle, and Managing a Research Project. And each of these online courses awards a certificate of completion to participants at the end. So obviously when people are starting out in their research careers, that can be a very valuable process to go through. And in addition to those online courses, I've listed 4 of the current webinars down there, which are therefore specific topics. And the LDC are very, very keen to make sure that they are fully conversant with members' needs. This is particularly important when they're planning future training, which is, obviously future planning goes on all the time. But at the moment, they're very keen for some member consultation to guide the training offering that they're going to provide for members in the future. So we would ask you to get involved in this. Let us know what's missing from your own in-house training, where your particular needs are, where you feel EphMRA could really offer some benefit for you as an EphMRA member, and let us know. There'll be a short online survey invitation going out shortly. But if it's easier for you, please do contact us. We're very happy to arrange a short telephone discussion. Email back to Bernadette, myself, or the LDC. The most important thing is for us to understand your needs so that your suggestions can be incorporated into the future plans. So the other large area that members report is particularly valuable to them in terms of their EphMRA membership is the networking side and profile, and this involves company profile and also individual profile for us on our careers. Again, some quotes in there that have come back directly from members about how important that is to them. And it's not all about selling. It's very much about peer-to-peer discussion and being part of the community and being part of the discussion about our industry and what's going on. So that's very, very important. And EphMRA is able to facilitate that in a number of different ways. So I've picked out some on the slide here. The ethics certification certainly rates highly. The feedback we get both from pharma companies and market research agencies is that that's the stamp of quality, as Bernadette referred to earlier. But there are so many other opportunities that EphMRA provides as well. The LinkedIn platform, some members value very highly. They can hear about latest news. They can get involved in discussions within that format. They can ask questions. They can share their views. It's gathering speed and pace as people post more and share more on that platform. The one-day meetings Bernadette's mentioned, and I'll go through those in a little more detail in a moment, but also opportunities such as submitting articles for EphMRA News. Again, if you have a hot topic where you feel you have something to say, please submit them for the EphMRA News. This comes out quarterly. We're always keen for contributions, and it's a great way to showcase your latest thinking and pose some questions for the industry, perhaps, in terms of where we're heading next and what we should be doing. The EphMRA logo Bernadette's mentioned, again, members are entitled to use that, and it's all part of the profile and the guarantee of being within the EphMRA community. The committees, as Bernadette's gone through as well. Webinars such as the one we have today, but there are a range of webinars that EphMRA produces over the course of the year. So keep a lookout for those, see what topics are of interest to you. Similarly, if there is a particular topic that you'd like us to focus on, any feedback that we can have from the membership helps us to guide what we do in the future. There's a Facebook platform now. We'd really like to encourage people to use that more. It's a slightly different demographic and feel to the LinkedIn page, and we do feel that there's a lot of opportunity there to generate discussion in a more low-key setting. So we'd like to see that used more as well. Agency members are entitled to their free listing on the website, and this means that anyone looking for a partner agency can have a look and pick out suitable EphMRA members that they would like to get in touch with for future collaborations. There are also the regional initiatives such as the one-day meetings, but that can spread out to other topics and platforms as well. The specialist groups Bernadette mentioned, and again, we'd really like to keep this dialogue going and find out which other particular groups you, the membership, feel would be very, very valuable to have as a specialist group. Please let us know. Conference obviously is a key one for many people, but not everyone can access the conference for various reasons, whether it's geographical or in terms of time and business pressure. One element that came out very strongly from the conversations that we have with EphMRA members is the opportunity for peer-to-peer discussions. And certainly I remember from my time in market research agencies and pharmaceutical companies, you don't actually have many opportunities to get together with your peers and discuss informally. And EphMRA's various platforms for networking allow this to happen and is recognised by members as a very definite advantage. Just to remind you about the Excellence and Best Practice Awards. So as Bernadette said, in terms of EphMRA's mission right at the start. We really are trying to encourage excellence in professional standards, and this is very much encapsulated in the Market Research Excellence Awards. Any EphMRA member can submit a paper. The winners have an opportunity to present their winning paper at the conference. There are 3 categories that you can see there, along with their very generous sponsors who make it all happen, including what we talk about in terms of future leaders, a case study award, which is really designed to encourage those researchers with less than 5 years experience to get involved and put some new thinking forward. So look on the website for new details, but the submission deadline for this year is the 28th of February. So we would encourage you to look at your own work and interesting projects that are going on and put something forward for that. A quick summary of the face-to-face meetings that are already in place for 2020. Obviously the conference, which we'll go through in a little bit more detail now, but we also have 3 chapter meetings. So these are the one-day meetings in each of London, Berlin and Basel this year. And again, keep an eye on the website, the LinkedIn feed or your EphMRA mailings for details of the topics and speakers. We do hear very positive feedback about the one-day meetings. What seems to be valued particularly is the more intimate setting. It's obviously a smaller event than the conference, and the opportunities this provides again for networking and discussion. So we'd like to see as many of you as possible being able to join in with those. A quick update on the conference. So this year we're in Antwerp. There is a dedicated conference website, so ephmraconference.org, which has all the details on. Registration is now open. The early bird prices are available until the 10th of March. So to remind you, I know many people find it difficult to plan ahead to June, but if you're in a position to do so, the savings are there to be had. And there are various packages designed to help as many people as possible to attend the conference. So there are member and committee discounts, individual day tickets, and also for agency members, free agency booths in the agency fair with multiple delegate places. So definitely worth having a look at that and seeing which package suits you best. The programme committee have been very busy as ever, and they've identified some high caliber speakers. I'm certainly looking forward to hearing not only them but the feedback from others as well. I think it'll be an exciting time to be there. A blend not only of the inspiration but also the practicalities, so practical case studies that we can incorporate into our daily working lives. And again, the feedback has been that that's the combination that people are looking for, not just inspiration and not just practicality, but this curated blend of the two. And this year, agile research that Bernadette referred to earlier. So this is a specific stream of papers tailored for field and operations specialists, focusing on the agile research. So we're hoping that that will generate some new discussions and some new topics suitable for that particular sector of the membership. So again, for full details, please do see the conference website. We're really looking forward to seeing you there. Very importantly, hot off the press, in fact, before the press, you've heard it here first, there are going to be 5 conference grants for young professionals. The feedback that we receive from previous conferences is that it is very difficult for any company to justify sending their more junior team members. And so these conference grants will enable those with less than 3 years experience, so first-time attendees at the conference, to actually come and see what it's about and be inspired and take that back as part of their professional development as well. So look out for news about that. Applications need to be in by the end of February. It's a simple process to do, so please do keep your eye on the news. And then just looking ahead, what are the next steps? As I said right at the beginning, the board are very, very keen for this two-way communication between members and themselves to guide the future priorities. And we would really encourage you to get in touch and get that conversation going. Bernadette and I have spoken to a large number of members. Obviously, there are a lot of you and 2 of us, so we are working towards speaking to everyone. But please do feel free to be proactive and get in touch with us. We'd really like to hear your ideas and suggestions. What are the challenges and pain points where EphMRA could support you? It's your needs and priorities for the future that we need to be looking at. Let us know. So please contact Bernadette or myself directly. We can arrange a short overview call to discuss your interactions and your suggestions for the future. Or email us, whatever format in your busy working lives works best for you. But your input will guide EphMRA's future direction, and we're very keen to know that every voice has been heard. So on that point, I will just hand back to Bernadette.
Lovely. Well, thanks, Sally. That was a great tour through the key benefits of EphMRA. But something I didn't mention in the beginning, and Sally's alluded to it there, we also do some in-company presentations. So sometimes we do go out to companies where we then outreach and personally visit, and we do on-site presentations as well. Similar presentation to this, similar deck, but also if you've got some people who, juniors, those less experienced, or you want to get other people, field, ops, etc., involved in getting an overview, or if we want to involve others in an industry setting, then yes, we do things like that as well. So just get in touch if you'd like us to also visit your offices. We're often down in London as well, and that can also easily be arranged. So any questions? Well, we have a couple of questions that have come in, and thanks for that. And they're both actually about the online training. So first of all, about the certification. So how long do the certificates last? So the certificates for the ethics and compliance training are valid for 1 membership year. So they all expire at the end of September 2020, which is then when the new membership year kicks in on the 1st of October. And we tailor it also to the cycle of the Code of Conduct update. So the Code of Conduct is updated between about February and May. It's quite an involved process. Once that's finalised by the Ethics Committee, we then update the training. That takes place usually in July and August, ready for the new membership year to start on the 1st of October. We have to update it because there are changes to our code, and also there are changes in the ethics environment, and that's why we do that. And how do you access that, the training? I can send you a link out. So to anybody here on the call, and I can see one person's asked for it, we can send you a link to that training, and your colleagues, anyone in your department who wants to do that training for ethics, just follow the link. You can just register. Not only do you see when you go in on the dashboard the ethics training, but you also see the 3 other skills-based training courses that we have there: Introduction to Pharmaceutical Market Research, Managing a Research Project, and Research through the Product Life Cycle. So we also have all those on the dashboard, and you can see when you've completed the course, there's a tick by it, and you can access your certificate at any time when you log in. So it's been great to have you with us today. We've really appreciated you attending. And as I say, we are recording this, and we will put it back up on our website for others to enjoy as well. You'll get a link as soon as we finish today to an online evaluation. It's a short SurveyMonkey questionnaire. If you could give us some feedback, that's appreciated, because obviously everything we do, we like to evaluate it, and we then like to improve what we're doing. So if there's no more questions, thanks very much for joining us today. It's great that you've stayed with us. We hope that we've given you a great overview of everything that EphMRA has to offer. There's probably other things that we weren't able to cram into this presentation today, but we can always discuss those on a call or on a presentation basis. So thanks very much from Sally and myself.
Thank you.
It's been great to have you, and we hope to connect with you again very, very soon. So have a great day, and goodbye from EphMRA.